My name is Sheyi Ojo. I'm a breast surgeon with fellowship training from Columbia University in New York City, New York. I usually tell women that breast cancer is not a cancer that's symptomatic, which means that a lot of times there are no symptoms. That's one of the greatest utilities for screening mammograms because we're able to identify breast cancer even before signs can show up. One of the things that could happen, however, if a woman does have any signs for breast cancer is bloody nipple discharge. Not all bloody nipple discharge is a sign for breast cancer, but it can be indicative of it. Sometimes women will feel a breast lump. In that scenario, they should seek medical attention as quickly as possible by first going to their primary care physician, who can then refer them to a breast surgeon for further evaluation of the lump. Screening mammograms are very crucial. Actually, that's the only diagnostic test that has been shown to reduce the risk of dying from breast cancer. Many of us believe in the breast surgery field that it's because it helps us to identify breast cancer at a very early stage where we can cure the cancer. And so screening mammograms are very crucial. Women should do a breast exam once a month. It's important also to pick a certain time of the month. For example, if you're still having menstrual periods, your breasts may go through changes depending on your cycle. So if you pick around the same time every month, then any changes would not be attributable to the cycle, but may be able to identify an actual change going on in the breast that may need medical attention. If you've identified that it seems to be breast cancer runs in your family, I would recommend that you start that conversation first with your gynecologist or your family physician, because it's going to be important to identify whether or not you are considered a high-risk patient. After a conversation with your gynecologist, your family physician, you should get a referral to a breast surgeon, a breast specialist. The conversation then will start with your breast surgeon regarding a referral to a genetic counselor. It's important to have a referral to a genetic counselor and have a conversation with them, because they can help identify what kind of genetic tests will be appropriate for you depending on what kinds of cancers are found in the family. So to reduce the risk of breast cancer, really live a healthy lifestyle. Live an active lifestyle, daily exercise. It can even just be 1 hour of walking, and eat healthy. Minimize red meats, processed foods. Try to cook your own meals. Eat what we call calciferous vegetables, which are vegetables such as broccoli and cauliflower. So over the past 3 decades, thankfully, the treatment of breast cancer has been evolving, both medically and surgically. In today's world, if a woman gets diagnosed with breast cancer and if it's caught early, for the most part, she has an option between saving her breast and having all of the breast removed, which is a mastectomy. And she may not have to have all the lymph nodes removed in her armpit as well. And so in that regard, breast cancer treatment has gone through a lot of evolution. With medicine as well, it's gone through a lot of changes. We're able to offer women better treatment. So right now, there's about 3 million women that are breast cancer survivors in the United States. For early stage breast cancer, the 5-year survival is greater than 90%. What that means is 5 years after the diagnosis of breast cancer, greater than 90% of women that were diagnosed with early stage breast cancer are still living. And that is just wonderful news, because no longer does breast cancer have to be a death sentence. Breast cancer can affect young African American women, and sometimes they may have a disease called triple negative breast cancer, which can be an aggressive type of breast cancer. You can get your mammogram at 35, and if you're told that it's normal, then you don't have to get screening until 40. But I encourage that you do a monthly self-breast exam, and that you get familiar with what your breasts feel like normally, so that if there's any changes, you can find and notice this early enough to seek medical attention. And I encourage that you don't ignore any changes to your breast. Continue your screening mammogram starting at the age of 40, and don't miss a year.